Hello everyone. So today's presentation topic is coronary angiography. So first of all, what is coronary angiography? A coronary angiography is an invasive procedure that uses contrast and X-ray to see if the coronary arteries which supply blood to your heart is narrowed or blocked. So angiography is a procedure. It is minimally invasive, and they uses contrast and X-rays to see whether the coronary arteries that are supplying blood to our heart muscles are blocked with any kind of plaque or fatty deposits. So this coronary angiography is a procedure that is helping us to find if there is any block in the blood vessels of the heart. So it involves placing a small plastic tube or catheter in an artery in the wrist or groin. The catheter is then passed to the heart, and the doctor will inject contrast into the coronary arteries while using a special type of X-ray. This allows the doctor to see how well the contrast flow through the arteries and if there are any narrowings or blockage that may have caused or increased your risk of angina or a heart attack. So next we are going to see the indications in which type of situation we are doing the coronary angiography. So the first is angina, which is chest pain, then heart attack. It may be ST elevated MI or it can be non-ST elevated MI too. Then heart failure. Next one is to investigate certain type of arrhythmias. Next is pre-operative assessment. This is for checking whether uh, we can do the procedure without any upcoming problems, like maybe if the procedure is not related to cardiac surgery, the patient can have the risk of developing any kind of coronary arteries if there is any cholesterol materials that is stacked up in the coronary arteries. So they do coronary angiography for preoperative patients. The next one is the abnormal non-invasive test. An abnormal or markedly positive stress test, atypical chest pain, when other stress or stress test or normal. The next is the periodic flow up after cardiac transplantation. So after having a cardiac transplantation, during the periodic flow up, they'll suggest doing coronary angiography to see whether the heart is doing its work properly. And the next is the contraindications. So we are going to see the absolute and the relative contraindication. So in the absolute contraindication, you can see the patient who is having severe contrast allergy can have this procedure. The next one is the acute kidney injury and the uncontrolled bleeding disorder. And the relative contraindication is chronic kidney disease, severe hypertension, active infection, pregnancy, and unstable patient. And the next is the materials that we use during the procedures. So first of all, we use the Chalco needle, which is a puncture needle, which help us to puncture the radial artery or maybe the groin. The next is the introducer sheath. Usually we use the 6 French size for a normal adult, but the size varies depending upon the age. The next is the guide wire, catheters, contrast media. We used the ionized contrast. The next is the contrast injector tubing. Then pressure line, syringes, three-way stopcocks, manifold, gauze, sterile drapes, and also gloves. Okay, so we'll jump into the procedure. So before the procedure, we have to check the patient's medical history, whether they have asthma, allergy, or kidney disease. The next is to ask whether the patient has any allergic reaction to any drugs or any current, or if they are taking any current medications which they have been prescribed by other doctors. And the next is the patient they may need to undergo various type of tests before the angiogram, like blood test, ECG, echo, chest X-ray, and cardiac CT. So the next is they should not eat anything. Means they have to fast for at least 4 to 6 hours before the procedure. So next is during the procedure. So during the procedure, what is happening? The patient is asked to lie on the table. A monitor will record the heartbeat during the procedure. The skin on the wrist or groin is cleaned with antiseptic wash, which means they use betadine to clean the particular area, and then it is covered with sterile drapes. A small amount of local anesthesia is injected in the access site to numb the area. A small incision is made at the entry site and the sheath is inserted into the artery. Then the next is they insert the catheter through the sheath into the blood vessel and carefully threaded into the heart or the coronary artery. So through the incision, they're inserting a sheath, and through that sheath, they're taking the catheter inside the vessels. So now, once the catheter is inside the patient's heart or coronary artery, they use a special type of dynamic X-rays to see whether the catheter is hooked on the right vessel. And then, usually, the patient cannot feel the catheter is moving through the heart because there are not enough nerves in the blood vessels. And next, once the catheter is in the place, a small amount of contrast is injected through it. Further dynamic X-rays are taken as the contrast goes through the blood vessel. The patient may feel a warm flush or tingling as the contrast is injected. So this procedure will take around 30 to 40 minutes. After the procedure, when the procedure is over, the catheter is removed and the incision site is closed with manual pressure. We have to give pressure for nearly 10 to 15 minutes so that there will not be any oozing of blood. Okay, then your blood pressure, pulse, breathing, and wound site are regularly checked. They are encouraged to eat or drink as soon as they feel able. They may be allowed to sit up after 4 hours. So finally, we are going to look into the complications. So some patients can have complications like allergic reaction to the contrast dye, including hives and itchy skin, bleeding from the wound, arrhythmias, heart attack, stroke, kidney damage, and infection in the site. So that's all about the coronary angiogram. Thank you.